So we'll take some questions.
Tony Miller, Recyc teacher. Do you have any views on how local authorities might engage the schools to give the local authorities the sort of support that they're going to need to make the changes that obviously have to go ahead?
One thing that I hope this government does understand is that you can't will the end, which in this case is low carbon or zero carbon schools, without willing the means by which those schools can get to that end. So the carbon reduction commitment for energy efficiency, in its sort of primal state, is a very interesting instrument. It's a very, I think, quite creative policy intervention to drive efficiency improvements and reduce CO2. But it will only work if it is possible for a local authority to work with its schools, gradually to bring up the quality of the built environment in those schools, and to enable them to meet these targets and not end up on the losing side of the CRC league table. And that means initiatives like Salix, what the Carbon Trust has been doing through Salix. It means that funding arrangements will have to be ramped up. It means that the government will have to do what the last government completely failed to do, which was one of the biggest frustrations for us on the Sustainable Development Commission. It means they will have to understand that sometimes you need to invest to save. And you need to invest lots to save lots. So when this study was being done for North Somerset, and they looked at the amount of money, the capital expenditure which would be required to bring all of their schools, some of which really are very old and in very shabby state, what would be required to bring all of their schools up to a fit condition for a low-carbon future. The capital expenditure involved is quite a big sum of money. It's a big sum of money. But then you track out the savings which come back on that investment. You know this story. And of course, very quickly, by about 4 years into the investment cycle, the savings are already not just paying back the capex, but then creating these ongoing savings for schools indefinitely during the period of that investment. Now, is this government going to be able to crack that? Is the Department for Education really going to be able to get to work with the Treasury this time around and say, this is your biggest problem? If you can't crack the disconnect between capital expenditure and operating expenditure, you will be staring in 3 years' time at a total failure, because none of the schools and local education authorities, the local authorities, will have been able to do what they need to do to meet the conditions around the CRC.
Hello, Tricia Zimmerman, Bournemouth Borough Council and NAFSO. Jonathan, based on what you've just said, how worried are you about the fact that this government might pull the plug on some of the BSF funding, and what pressure can the department put on it to make sure that we keep these capital programmes going? No,
I am worried about that. It looks like an easy target, doesn't it? It looks like something you can just hack out 10, 20, 30% of and make it look as if it's, quotes, a saving, when we all know that this is still a government that is struggling to tell the difference between investment and expenditure. And I don't know why our governments historically have had such a problem about this. I mean, BSF is classic investment in the infrastructure which we need. It isn't really public expenditure of the kind that we're talking about reducing. So I am quite worried about that. And I'm worried that they haven't already confirmed what the BSF story looks like, because it's potentially such a good story. Such a good story. Maybe I've missed it. I don't know. Sorry, I'm not. It's still waiting. Yeah. Yeah.
Anna.
Hello, Anna here from LEAF, London Environmental Education Forum. I read recently that London had the biggest difference in income of a city in the developed world. And I was just wondering, do you think this is going to impact on our work on sustainable schools?
I think this question, this challenge, looms over practically everything that we might seek to do to create conditions for more progressive change in society. And I'm particularly conscious of that inside the health sector, where they are going to be required to do far more about health inequalities, and there will be some redirected prioritization around health inequalities at the local level, which probably won't be matched by any change in the net spend, because at the moment the spend of the NHS is 96% geared to acute services, so downstream sorting out the mess that we're creating upstream, and 4% devoted to public health, health inequalities, and the whole of that aspect of recalibrating people's lives and communities to deliver healthier lifestyles. So it's a massive problem, and when you really track it back, as Richard Wilkinson and Kate Pickett did last year in a book that is still haunting me, to be honest. It's a book called The Spirit Level, which is something I read and got very worked up about last year, and I'm still kind of very worked up about it, because it's an analysis about what's going on in different parts of the OECD, and it essentially correlates patterns of dysfunctionality in society against the income gaps in those societies. And it's an extremely simple, rather daunting hypothesis, which he is suggesting we all need to test out, which is the more unequal a country is, the higher the incidence will be of many of the things that are causing such damage to people's lives today. So mental illness, lack of social mobility, maternal mortality, prison numbers, loss of trust in society. He runs through these 11 different areas of dysfunctionality or breakdown or pathology, addiction and so on in society. And then he contrasts what happens in every single one of the OECD countries. And the correlation of the incidence levels for each of these things tracked against income levels and the gap between rich and poor is so compelling, you kind of look and you think, whoa. And the UK is the third most unequal country in the OECD. So the United States is way out there as a kind of mad outrider, almost as if they'd systematically pursued inequity as a policy objective since the election of Ronald Reagan, and can now put a big tick in the box and say, hey, we're top of the league. Fantastic. And honestly, it does look like that because they're so far off the chart, you can hardly find them in terms of inequity. And then Portugal is the second most unequal country. I don't really understand that. And we're the third. And down at the bottom, you've got, i.e. the most equal countries, so the least inequitable countries. You've got what are called the usual suspects, the Scandinavians and Benelux countries, and Japan. And Japan is the most equitable country in the OECD, with the lowest gaps between the rich and the poor. And of course, conventional wisdom would tell you that Japan is, quotes, a basket case. I'm using the language used by The Economist magazine. An economic basket case because it's only grown by 0.4% per annum over the last 10 years, which is deemed to be tantamount to total failure. And yet, Japan has got an incredible success story to tell on all of these indicators of social and individual well-being, lower levels of these dysfunctionalities, pathologies, with the one exception of suicide levels amongst young people, which is a really weird one. And Richard Wilkinson, Kate Pickett's book, just rocked me because it put this huge question mark over everything we do. If that pattern of inequity is so deep in UK society and shaping so much of what happens in the lives of so many people, are we ever going to be able to do what we want to do without addressing that core issue, without actually getting to grips with continuing, persistent, perverse social injustice of the kind that is just destroying the lives of millions of people? And that's a bit of a sobering note. I'm sorry, I don't really mean to end on that, but it kind of struck me that all the things we're trying to do on health and education, communities and blah, 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 all these kind of things, so much of what we are failing to do is actually driven by patterns of persistent inequity, not by a failure to make good outcomes in schools or in health services or whatever it might be. So that's difficult. Sorry about that. Have a look at this book. It's an incredible piece of work and I think very telling. And I'm told that Ian Duncan Smith has actually encountered this book and is very impressed by it. So who knows, there could be lots of surprises ahead.